I recognize the gentleman from Ohio, Mr. Rulli, for 5 minutes.
Well, it's good to see Ohio in the house, so God bless you, sir. I just want to take a second, and I want to thank Mr. Morris for all your hard work at HRSA. It means the world to us. We appreciate it. I'm proud to join as an original co-sponsor to Chair Carter's bipartisan HR 2493, the Improving Care in Rural America Reauthorization Act. It extends grants and helps rural residents who have trouble accessing health care. And I think this is a really interesting bill for myself because I think this is one of the first times that I've actually seen on the Hill versus the State House years that I did where we have bipartisan support for a cause. So I think it's really reassuring and refreshing to see such a bipartisan approach to this problem. And it is a problem. I'm going to give 2 quick examples of personal tragedies that I've seen within my district in the last year. Directly north of my district in Warren, Ohio, was a hospital called Trumbull Memorial Hospital, where actually my son was born. This hospital got gutted by Steward Health out of Boston, Massachusetts, for some shenanigans they were doing within their financing of the actual hospital. The hospital closed, so the biggest ER within a 45 to 50 mile radius was shut down. The problem is with that, when you live in northern Trumbull County or southern Ashtabula, Ohio, which is all in the eastern part of Ohio, you would now have to go to the Cleveland Clinic or University Hospital within the city limits of Cleveland, or you'd have to drive down to Youngstown or Pittsburgh. Some of these areas are an hour away, so if you're having a heart attack or a stroke or another medical emergency, there will not be logistic times to get you to that ER. These are the kind of problems that we're dealing with rural hospitals. Besides that, another example is down in Marietta, Ohio, which is the very southern part of my district, almost a 4-hour drive from Trumbull County. These are examples of the problem within rural America that we're facing, that both parties can go across party lines and we could join hands together and fix these problems. In Marietta, they realized that there wasn't a possibility of them having a children's hospital unless you went to Nationwide, which is in the city of Columbus. That's 2.5 hours away. In order to get you into Pittsburgh for another emergency is 1.5 hours away. People will die. There is a major problem in this country with rural hospitals that we have to fix. And it is something that every elected official is brought onto the Hill to try to do. The Reauthorization Funds program that provides insulin and blood pressure medications, strengthens telehealth, and telehealth is going to be incorporated with all this broadband work that we're doing because we have to give them the tools to actually make telehealth work. And also manage just chronic diseases. Health outcomes should never depend on someone's zip code. I think that is atrocious in a country that is the epicenter of the world, that we have problems just because we have poor rural America that does not have access. On the heels of the big, beautiful historical bill, contrary to popular belief, there is $50 billion investment in rural health care. This is what happens when you get to the finish line of any piece of legislation and the two parties and everyone starts working together. We realized that there was a hole with the rural hospitals, and we got $50 billion in investment in rural health care, which will have a profound impact. I'm very happy to support this legislation. I'm happy to go across the aisles. And with that, I yield my time to the chair.